Welcome to today's presentation, the second presentation on the peptic ulcer disease treatment by dietary management. My name is Nasiru Eric Morishdi. I'm a clinical dietitian and nutritionist. In the first presentation, we discussed on the pathophysiology of peptic ulcer disease. We saw a lot of things, a lot of information on the causes, clinical presentation, medical treatment, and surgical treatment. Here we are going to finish up on the dietary management of peptic ulcer disease treatment. Later we call back. As I told you in the first presentation, please, and over please, my dear, please, I introduced well on peptic ulcer disease in the presentation. Please, through the previous presentation, if you don't have, please get download on YouTube or find it Dr. Name in YouTube so that to get a full package concerning with the peptic ulcer disease. In the peptic ulcer disease, we have duodenal and peptic ulcer, duodenal and the peptic ulcers. The duodenal ulcer occur in the duodenum, and the peptic ulcers occur in the what? In the stomach. Sorry, the duodenal ulcer and the gastric ulcer. The general peptic ulcer we are divided into duodenal ulcer which occur in the duodenum and the gastric ulcer. Sorry, this is the gastric ulcer. The duodenal ulcer occur in the duodenum, but the gastric ulcer occur in the gastric portion. In the duodenal ulcer has some indication which can help us to differentiate from the gastric ulcer. In the duodenal ulcer, epigastric pain occur 1 to 3 hours after eating, which is unlike to the gastric ulcer which occur within 15 to 30 minutes after eating. It is important to note here when the food are being eaten, when the food enters the stomach, in the stomach here we have a pyloric sphincter. Therefore, the pyloric sphincter closes. Therefore, for proper digestion of food in the stomach. When the pyloric sphincter closed, the stomach, the food is inhibited from being entered into the duodenum. Therefore, during eating, the stomach pyloric sphincter closed. Therefore, there is no passage of food into the duodenum. When the food, after being digested 1 to 3 hours after being digested in the stomach, this food, the pyloric sphincter allow the food from the stomach to move from the stomach into the duodenum. Therefore, if a patient have duodenal ulcer, will experience a pain between 1 to 3 hours. That is the reason why epigastric pain occur 1 to 3 hours. But for gastric ulcer, the pain occur during eating or 15 to 13 minutes after eating. That is why during the presence of food in the stomach, it is where the parietal cells secrete hydrochloric acid. Therefore, when secrete the hydrochloric acid, when secrete the hydrochloric acid, an acid causes an ulceration. An ulceration, when enters into the what? Into ulceration, they causes pain. Therefore, that is why we are talking that the gastric pain occur in 15 minutes during eating. And that is the reason why when a patient during eating when senses pain can stop to eat, can stop to eat. And is that why therefore when stop to eat, we may have an effect of weight loss in weight loss. But if patient have duodenal ulcer, that means the patient will eat and the food will enter the stomach. When entering the stomach, therefore will move again to the duodenum. Here we'll have a weight gain. Then also relieved by eating and acid. That is the reason I have explained already. During eating, the pyloric sphincter are closed. Therefore, there is no passage of food into the duodenum. There is no passage of food which will cause the pain in the duodenum during eating. Therefore, when a patient with duodenal ulceration will not experience the pain during eating, but he will experience pain several hours after eating. But also period of symptoms alternate the period remission. But also may interrupt sleep. When someone go to sleep after eating, go to sleep, for instance, at night, the food are being digested in the stomach at a certain time, for instance, hour. After an hour, the food will pass from the stomach into the duodenum. When entered to the duodenum, interrupt the sleep. That is why we are talking that duodenal ulcer interrupt sleep, but the gastric does not. But also the duodenal ulcer is associated with what? With the weight gain. Those are indication that can make you to identify that you have an duodenal ulcer or gastric ulcer. But also we have got complication of the ulcer. We have bleeding. If an ulceration, it is deeper to the blood capillaries. From the stomach to the blood capillaries, the blood can pass can pass through an ulceration into the lumen. Entering the lumen can mix with the content, so that cause bleeding through vomiting, hematemesis, vomiting, or Melinor stool, the discoloration of the stool. But also we have perforation. This is among the complication in which there is allowing of gastrointestinal content like gastric secretion and undigested food into the peritoneal space. Mostly for duodenal ulcers, when perforation occur, air collecting under the diaphragm, causing irritating nerve. That is, we hear in the what? In the pain up to the referred to the shoulder pain up in the shoulder. That is perforation. That means the gastrointestinal content are moved are moved into the what? Into the peritoneal space. For instance, the gastric secretion and the undigested food. These are mostly occur in the what? In the duodenal ulcer. These occur mostly in the duodenal ulcer. But also we have gastric outlet obstruction. These gastric outlet obstruction in some cases may causes vomiting. But also we have pancreatitis. The pancreatitis is among the what? The complication of peptic ulcer. But we have alarm symptoms. The alarm symptoms, we have bleeding, weight loss, but also progressive dysphagia, difficulty in swallowing. Difficulty in swallowing can be an alarm for for ulcer. But also we have iron deficiency anemia, since there is a loss of blood through an ulceration in the mucosal lining. Therefore, if there is a loss of blood, an iron will be lost in the blood. But also we have recurrent emesis. These are alarm symptoms that can indicate you that there is an ulceration. Thank you. Therefore, let us jump on treatment. Dietary management of peptic ulcer disease. On the dietary management, let us first we look on the foods to avoid. There is foods to avoid for patient having an ulcer. The first is the coffee, tea, and chocolate. These food, tea, coffee, and chocolate for patients with PUD, peptic ulcer disease, have to avoid this food because it increases the acid production in the stomach. When increase acid production in the stomach, the acid can cause ulceration of the ulceration of an ulcer. Therefore, we have to avoid it. But also we have spicy foods and chill. We have spicy food and chill. These also are not important for patient having peptic ulcer disease because this food influences an ulceration, but also this food for also we have a processed food. The processed food also may promote, for instance, the processed sugar may promote the development of H. pylori. But also we have acidic and citrus fruit. The acidic and citrus fruit, these irritate an ulcer for some individuals and causes hyperacidity. This is for some individual. That for some individual increases acid production. Therefore, we have to avoid, for patients having PUD, they have to avoid an acidic and citrus fruit. But also we have deep fried, oily, or fatty food. We have to avoid. We have to avoid this food, deep fatty, oily food. Why? For the reason that a patient who utilize the proton pump inhibitor, that means there is low acidity in the stomach, and this fatty food has slow the digestion. Therefore, in the stomach there will be increase of an acid in the stomach for digestion. This acid, when are being secreted in higher, they cause an ulceration. But also we have alcohol and tobacco. And alcohol irritate the ulcer in the stomach, but also we have tobacco impair the healing of stomach ulcer. But also we have to avoid the larger portion meal, as how we can look here, the small meal, the second, the third. Here we have the small meal. For a patient with peptic ulcer disease must utilize the small meal, must avoid the larger portion, must avoid. If the small meal, can take the small meal frequently in a day, because when we take the